Yeah, I think one of the most important papers in transplant in the last decade was the report of the MORPHO study in the Journal of Clinical Oncology this summer. And this is, you'll remember, is a randomized study of gilteritinib maintenance in adults with FLT3 positive AML who underwent allogeneic transplant. Whilst the overall study was not statistically significant in terms of a survival benefit, in a pre-specified subgroup, those patients with pre or immediately post-transplant MRD positivity, there is clear benefit from utilization of gilteritinib as a second-generation FLT3 inhibitor as maintenance therapy. So I think it's a big breakthrough. Conceptually, it shows that maintenance therapy can improve outcomes, and the search now, I think, is on for other possible targeted therapies. There's potential use of menin inhibitors in this setting, or possibly IDH1 inhibitors. And of course, our group has been very interested in using oral azacitidine, perhaps not such a targeted therapy, but nonetheless well-tolerated oral agent. And the Amadeus trial will be reporting out later next year, having randomized 320 patients to receive post-transplant maintenance. So I think the messages are that post-transplant maintenance is coming. There's evidence for it. We need to think of other interventions. And secondly, we need to be more selective about which patients will benefit from post-transplant maintenance. And that's likely to be people who have evidence of MRD before going into transplant.